Welcome to this presentation on behavioral healthcare services and documentation. Behavioral healthcare uses the Diagnostic and Statistical Manual of Mental Disorders published by the American Psychiatric Association. This classification system is used to diagnose and classify mental illness. The assessment of mental and emotional health is broken down into 5 dimensions that are listed on the next slide. The 5 dimensions are broken into 5 axes. Each axis represents a different assessment area for patients. The first axis is where a provider can record any clinical disorders of the patient. These include diagnoses such as ADHD, autism, substance-related disorders, psychotic disorders, and eating disorders, just to name a few. The second axis is for personality disorders and mental retardation. Examples of these type disorders include paranoid personality disorders, borderline personality disorders, and antisocial personality disorders. The third axis is where general medical or physical concerns that may have a bearing on understanding the client or patient's mental disorder is listed. Recorded here are concerns that could affect the management of the client's mental disorder. The fourth axis is where psychosocial and environmental problems get listed. The following will be recorded under this axis: problems with a primary support group, such as a divorce, abuse, or death, problems related to a social environment, education problems, occupational problems, housing, and economic problems. The fifth axis is for global assessment of functioning. A number between 1 and 100 is listed to reflect the caregiver's judgment of the level of functioning. In general, 100 is no symptoms, 90 is minimal symptoms with good functioning, 80 is transient symptoms that are expected reactions to psychosocial stressors, 70 is mild symptoms or some difficulty in social, occupational, or school functioning. 60 is moderate symptoms or moderate difficulty in social, occupation, or school. The list continues down to a 10, which is a persistent danger of severely hurting oneself or others, or a persistent inability to maintain minimal personal hygiene, or serious suicidal acts with clear expectations of death. Mental health services are given in many different settings. A mental health patient can be an inpatient in a facility, a resident or living in a facility, or an outpatient that comes in to seek services and then returns home. The special settings include places where mental health services are provided. They are community mental health centers that provide patients access to counseling services. Some employers provide employee assistance programs for their employees. They may contract with a local outpatient mental health center and allow employees to visit for free, or have so many free visits before the employee becomes responsible. Employers have found providing these services helps their workforce as a whole. Schools and universities provide mental health help for students. Even in elementary schools, there are counselors that can see students based on referrals from primary teachers. The counselors are also on hand to help with any counseling the school may need to help students cope with death, for example. Colleges and universities have recognized the need to have their students have access to mental health services as well. It is quite an adjustment attending college, and some students find they can adjust easier when they have someone to talk with regarding obstacles they may face. Switching gears just a little in the presentation, there are documentation issues that need to be evaluated and addressed in mental health services. There are very strict guidelines on seclusion and restraints used on patients. Medicare has standards on what types of restraints can be used and how often they must be checked, as well as the patient being checked. Suicide watch is very similar. You must have regular intervals on checking on patients in both of these situations. Minors is another area. Some states allow minors to receive mental health treatment without informing their parent or legal guardian. In these instances, minors must consent for their parent or guardian to receive copies of their mental health records. If they do not provide consent, their parents or legal guardians cannot get copies of the records. Think of how much of a challenge this is to document in the mental health record. On the subject of documentation, the HIPAA law spells out special protection for psychotherapy sessions and releasing these type notes. In most cases, they can only be released with a court order from a judge. The client or patient may not even be entitled to their own psychotherapy records. If the provider or therapist deems the patient a harm to themselves, they may not receive a copy of their own documentation. There are also instances where a patient has a court-appointed guardian that makes decisions on their behalf. The family would not be allowed to make decisions or obtain copies of documentation without the guardian providing consent. Conservatorship is where a patient is placed under the care of an appointed guardian. The requirements do vary from state to state, and the documents of conservatorship become part of the medical record. Behavior care or mental health records contain the various types of information listed on this slide. There are both some similarities and some differences with other type records. Information that is unique to behavior care records include the outpatient crisis plan and certifications for holds, restraints, and seclusions. The Council on Accreditation accredits different types of behavior health facilities. Just like any other accreditation, there are specific standards that must be met in order to receive accreditation status. Quality documentation is key in order to ensure a successful accreditation survey. Behavior health centers must follow the Medicare conditions of participation if they wish to treat Medicare patients. CMS outlines specific documentation requirements that must be completed by inpatient mental health facilities. The specific items are listed on this slide. Records pertaining to drug abuse, alcohol abuse, and HIV/AIDS have specific provisions under the national privacy laws. Records containing this information cannot be released without direct consent of the patient, or a court order can only release these type of records. There is a federal agency of the U.S. Department of Health and Human Services that is an advocate for behavior health care. This is the Substance Abuse and Mental Health Services Administration. They also provide funding and offer programs to assist substance abuse and mental health patients. Lastly, health information professionals play a role in the behavioral health care setting in regards to patient documentation. They must stay on top of the latest laws and rules that govern documentation in these areas. Most importantly, they are the ones protecting the privacy and security of behavioral health records. They must know the laws and only release this highly sensitive information to those that are authorized to have it. Thank you, and that concludes this presentation.